Hey Sam, I'm
Hi.
very happy that we're doing this today. Thank you. Let's just start with what you do as a researcher. So I was looking at your Google Scholar page and you said, I'm a professor of machine learning and public health. Is it the way that you identify or introduce yourself to the world?
I suppose so. I had a background. I did my PhD in statistical genetics and
Mm-hmm.
viral genetics. And then I moved on to doing spatial epidemiology and then expanded into many fields. I'd like to think of myself as an interdisciplinary researcher. I'd like to think of myself as a mathematician, but I think as most people who are mathematicians know, no one really admits to being a mathematician because
Some application.
there's always some mathematician above that that's a real mathematician and makes you think, I'm not at
Yeah.
all a mathematician. I'm some sort of applied guy. I think the best way to describe me is I'm a public health guy. I'm interested in human health.
But your bachelor's and your like basically education was in statistics.
No, actually, it wasn't. My bachelor's was in chemical engineering.
Uh-huh.
So I really hated it actually.
Okay.
Not to put down any engineers out there.
Uh-huh.
It's just I really enjoyed biology, physics, chemistry, and mathematics in
Mm-hmm.
school, and I thought, how do I pick a field that encompasses all of these together? And it looked like chemical engineering was the thing. But then, halfway through the degree, you're kind of trying to figure out what screw and what type of steel to put into what reactor,
Yeah.
and it just wasn't interesting. But during my chemical engineering degree, I did a project on mad cow disease, BSE,
Mm-hmm.
and I think that got me interested in mathematical modeling of infectious diseases. And so after my
Uh-huh.
bachelor's in engineering, I then did computational biology.
And
And
it was
so
back in like Oxford
this was
or
in Cambridge,
Cambridge.
computational biology. And so that was my first introduction into maths,
Mm-hmm.
really, because I mean you do quite a bit of maths in engineering, of course, but it's very different, right? Differential
Yeah.
equations, modeling systems. When I went in to do computational biology, which was a course in Cambridge, shared with the part three course at Cambridge, the kind of famous mathematical master's program. Um, I started getting into this world of maths, and it was there that
Mm-hmm.
I found out about machine learning because quite a lot of the course had machine learning into it, and I was
Mm-hmm.
just fascinated by
And
some of the
do you
approaches.
remember what year was it? Was it like
2005 was it?
five?
So
Okay.
quite early on, the times of the great David McKay and others
Uh-huh. Yeah.
in Cambridge. And then, I had the point at that after my master's, what do I do next, right? And
Yes.
I guess I really enjoyed the science and doing mathematical modeling, and I just enjoyed the technical aspects.
Uh-huh.
And so I was lucky to get a PhD studentship in Oxford
Mm-hmm.
with uh, with Oliver Pybus doing viral genetics. So it's a bit of a change.
Mm-hmm.
And I guess in all of these, I never really was trained in statistics or trained in mathematics, and I've kind of done independent study as best as I can. I think sort of reading books like this,
Understanding.
understanding analysis. So to try to understand real analysis and
So is it like analysis in a way that mathematics?
real analysis.
Okay.
So
Yes.
just trying to get the basics, and you'll see lots of basic statistics books up
Uh-huh.
there. And
Yeah.
I think I have here Bayesian data analysis, Andrew Gelman's amazing book.
Yes.
Um, so try to self-taught to some
Mm.
degree on all of these, right?
But what was the topic of your PhD then?
So the topic of my PhD was looking at natural selection in viruses. So
Uh-huh.
we know that natural selection happens and it selects those that are best adapted to an
Mm-hmm.
environment, right? How do you detect it, right? And we normally think of natural selection as explained by Darwin, with
Mm-hmm.
the moths or the finches. But in a world where molecular data,
Mm-hmm.
right, the genetic code that really encodes everything,
Yeah.
how do you detect the signature of molecular selection in
Mm-hmm.
genetic code, right? What statistical methods can you use?
Okay.
And so these were the tools I developed in my PhD, which was looking at how do we detect, selection in influenza.
Mm-hmm.
Was the main focus of my PhD.
And by selection in influenza, you mean how the virus has
Yeah,
changed
positive
or?
selection,
Uh,
which genes in the virus are are being put under selective pressure, either
mm,
positively or negatively or neutrally.
cool. And after that, you did a postdoc in Imperials or
No, so after that, I kind of, it was after the PhD, like I think most junior researchers have to figure out what to do next. And
yeah.
I did a 1 year postdoc with my PhD supervisor. I was very lucky that he kept me on for a year. And then I guess I had a choice, and because I like the technical aspects, I thought about going to work for a bank,
Mm-hmm.
and was applying for quant jobs again. It was
Yeah.
around 2010, the period of the quant
Yes.
heyday. But then I saw a project doing spatial epidemiology, and spatial epidemiology has a very interesting set of methods.
By spatial epidemiology, you mean when diseases are propagating in some space
Some
or
space, yeah. And you are trying to understand the spatial pattern underneath the
mm,
disease. And I was less interested in the problem of spatial epidemiology than the method. And I was very interested in that time at learning more about stochastic processes, random processes.
mm-hmm.
And one of the most popular stochastic processes in spatial epidemiology is something called a Gaussian process.
Yes.
And it's just, it's nothing more than encoding the belief that things near to other things are similar.
Yes.
So, if you have an area in a village that has high malaria, a village right next to it
Mm-hmm.
probably also has high malaria because, the mosquitoes there, the environment is similar.
Yeah.
Lots of factors are in there similar.
Yeah.
How do you characterize this spatial pattern
Cool.
is I guess the method that I was looking to develop, and then I did a postdoc in that and worked for a group called the Malaria Atlas Project. This was again still in Oxford, for about 6 years until I was given an opportunity for my faculty position at Imperial.
Mm-hmm.
And then once at Imperial, I started branching out into many different topics.
Okay. So basically, you started working mostly as a mathematical epidemiologist,
Yeah.
dealing with models,
Yes.
and to some extent, you had data because you had to calibrate it,
Yeah.
or was it like a lot of modeling, and then you said,
No, it was very data driven. And
okay,
I think one of the amazing things the Malaria Atlas Project did at the time. So just to give you a bit of context, so the Malaria Atlas Project was this project started up, in the 2000s,
mm-hmm.
and it was geared to try to determine where malaria is high or low
Yes,
in sub-Saharan Africa. And so the metric that we use is prevalence.
yeah,
What proportion of children that you sample in a village
mm-hmm.
are malaria positive or have the
Mm-hmm.
parasite in their blood or not? And of course, you have so little data in sub-Saharan Africa, right?
Sure,
In the 1950s, there was the Global Malaria Elimination Program, eliminating malaria from large swathes of the world,
mm-hmm.
like in North America and Europe and Southern Europe, etc. But sub-Saharan Africa was largely left untouched.
Yes,
And by the 1990s to early 2000s, it was approaching a humanitarian catastrophe in terms of the number of children dying of this treatable disease.
mm-hmm.
And so a really large campaign had gone about to try to drive malaria down. This was part of the Millennium Development Goals. This was part of something called the Abuja Declaration.
Mm-hmm.
And lots of money went in to try to drive malaria prevalence down. But how do you evaluate what the outcome of this campaign was, right?
Yeah.
There's so little data.
Mm-hmm.
And so in a sense, you've got sporadic data distributed across space and time, so different regions in Africa at different times.
Mm-hmm.
And then the question that is you need a statistical method to fill in all the gaps.
Yes.
And that's the method that we try to develop.
Mm-hmm.
And at the same time, try to estimate what are the impact of the interventions coming in there.
Mm-hmm.
And so this was the sort of work I did before I got my faculty position.
Mm-hmm.
And I guess it's work that I'm probably best known for, is determining the change in spread of malaria through space and time.
And then you started as a professor having your own team.
Yeah.
And at what point in your career you start basically thinking about AI as a very good tool for what you want to achieve?
I suppose, I've been chasing interesting bits in machine learning throughout my career, right?
Yeah.
And at some point, machine learning as a term became deep learning, became AI, right? So I think it has just been a continuous journey, right? To try to find and try to work in the hottest machine learning topics, right? At the time I was doing the malaria work, Gaussian processes, which in machine learning generally are referred to as kernel machines.
Yeah.
They were the hot topic at the time. And I was really interested in Gaussian processes and did a lot of work in there. And I guess as time has gone on, I kind of followed the trends and expanded into other aspects of sort of what they call AI, the generative models, etc. Right.
And what are you working on these days mostly?
So, I mean, to give some context, I guess the big vision is this. So, I did all this work in sub-Saharan Africa, right? I myself grew up in Kenya until I was 18, at which point I came to the UK to do my undergraduate in awful chemical engineering. But having lived there and having spent lots of time working in sub-Saharan Africa, for a long time I was employed by the US government, the PEPFAR program, and UNAIDS to study HIV. And it was a real privilege working for UNAIDS at the time. It really gives perspectives about how difficult it is on the ground, right?
Yes.
And how large the challenge is, right?
Yeah.
And I guess, at least in my role then, one of the biggest challenges was I was developing software, right? Or developing methods for people in sub-Saharan Africa to use, right? And the methods that I was developing are so complicated that very few people really understand them. And it takes,
even in terms of practical implementation,
what these methods are doing, what they mean, right? You can't just give somebody a tool and expect them to run and understand this, right? I mean, I think this is very natural for us to all understand. We all have some area of research where somebody is doing some incredibly technical work. They give you the package and you're like, I don't know what to do with this. I don't understand it. I can't. I can press play and that's all I can do. I can't understand it. I can't open up the hood.
Yes.
And I guess at the time, the idea was to develop software to make it as easy as possible, right? Or to summarize the results in a way that it could be most usable for people on the ground. And it's clear that AI is now providing a alternative route. So I guess one of the challenges, and people might disagree with me, this is that I could fly to different countries in sub-Saharan Africa. There'd be varying amounts of expertise. South Africa has an incredible amount of expertise. Democratic Republic of Congo, perhaps less so. I could fly there and train up some researchers in a particular tool. And then maybe they leave, right? Because now they have a great expertise. They can go to a better job in a better place. This is very natural to happen. Or they learn this tool and they can use it from then onwards, but then something new comes around. Now, who's going to train them in the next step, right? Where are the resources to train these staff? How do you empower staff there? And I guess we could invest more in these countries. And I think that the way that the world is changing, that this is less likely. And it's perhaps not something that many people want, because it's not necessarily you want to, the large concept called decolonizing global health, which is not having countries beholden to European countries, or US or the US. So AI, I believe, is providing a new way to do this, right? Already, if I were to give somebody an output in a low-income country or a method, the first thing they would do is go into their favorite chatbot and ask, what does this mean? And so I think that AI now provides a new opportunity to help individuals load data, run some specific sets of models, and summarize the results from them. In a sense, the AI replaces me flying to the country as a tool to help them run the analysis, an empowerment tool.
Okay, so I see. So of course, this is like mostly the part of training and doing more mainstream type of thing that
training
are
and
not that
summarizing. Exactly. The whole suite, right? Just, creating a report of your results that you can share to your Ministry of Health. Right?
But this is not unique to public health or epidemiology. I mean, any other disciplines or any other field would say that, this is like a widespread application, right?
It is. It is. I guess I would say that in infectious disease, that's where the children are dying, right? So this tool is, of course, training individuals in physics is great in these countries, but to what end? We're not going to be building particle accelerators or telescopes, right? Except on some mountains perhaps. But with infectious diseases, they are I've met, when I travel there, these incredibly talented people that are already managing the situation on the ground there
Yeah.
as best as they can and doing an amazing job at it.
Mm-hmm.
All they require is more tools to help them do their job more effectively.
Yeah.
And I think AI provides an avenue to give
Mm.
them more tools, right? But ultimately, that's within their control. They don't have to send me the data, right? They don't have to, include Imperial College London and, have me go write a paper that benefits my career. No, this is under their own control. And I think a lot of ministries of health would appreciate that, right? That the fact
Yeah.
that they can control their own narrative to some degree,
Yeah.
based on their own data that they've
Yeah,
generated. And so I think AI, provides, obviously the AI is the big thing.
Yeah.
Right? I mean, it's poised either to, it's already here. It's poised either to change the way we do things in many fields, or just to expand the current suite of things that we do. And I think especially in the realm of infectious diseases,
Yeah.
there are lots of avenues that artificial intelligence can really make a difference. So one is, as I said, the training, the chatbot, the outputs. The other is, the US government has just closed down a program called the Demographic Health Surveys Initiative that was generating surveys. How are we going to get data on the ground, right? Ultimately, all these tools, all the reporting, all the methods require data, right?
Yes.
Without data on who's infected where,
Yes.
we can do nothing. AI tools can potentially help us design more cost-effective ways to gather data. Surveys, where to sample next, who to sample, where to go to try to get the most cost-effective way of trying to figure out how high HIV is in a place or how high malaria is in a place.
Okay, I see. But like in terms of doing research, so of course there is like these field-wise type of approaches, then we have gathering data. And now imagine that you have your own data and you want to run a model. So according to your background, you were doing modeling, but now you have enough data and you can basically fit this data to some AI, some machine or robot, and then it gives you some prediction. Is it the way that you are now using it in your daily research?
I think it's just a move, and it's always been a bit of both, right? I
Yeah.
mean, the idea, I guess, in many fields. So if you're from a physics background, aren't you,
Yeah.
right? So in physics, mathematical equations is to some degree exactly how physics works.
Yes.
It's a pure encoding of the laws of nature. Right?
Mhm.
General relativity can be described by the field equations, which explains an incredible amount to incredible detail. Quantum electrodynamics can describe certain phenomena to 8, 9 decimal places. At that point, you have to say that we understand reality via the mathematics.
Yes.
Now, if you start moving into fields like chemistry, then biology, and then the social sciences, this dilutes over time because we end up with this phenomenon called emergence, coined by Anderson in 1972, I think, where new laws emerge at different levels of hierarchy. So you end up now with this balance where you can't possibly hope to have some field equations that can describe how malaria spreads in sub-Saharan Africa and expect that to work.
Yeah.
The process is too complicated, too many feedbacks. It's impossible. So what you try to do is this balance where you have some mechanisms that encode what you know epidemiologically, and then data that helps fill in the gaps in between. So it's really not one or the other, right? You don't really want to treat this entirely as some curve-fitting problem. And you don't want to treat it entirely as a series of equations. It's this kind of, we call it semi-mechanistic, this in-between area of mechanism. And I think AI can help expand on the data part, on determining the mechanisms, and determining the equations.
Yeah. Okay, cool. So let's move to the COVID time. So I guess you've been living in Denmark for I guess quite a while, and
Yeah, since 2021, I guess.
yeah,
So right in the pandemic.
yeah. So and in 2021, it was a very important year in Denmark because it was the year that basically vaccination started and huge testing was going on a campaign. So as far as I remember, every week people had to get tested at home 2 to 3 times, and if it was positive, they had to take a PCR, and if the PCR was positive, then they sequenced the sample. And thanks to that, now Denmark has this huge sample of positive tests, and you've been involved in analyzing those data, right? So you look at all of those data and saw how the new mutations has have happened, like over the course of the pandemic, especially how Omicron wave came and something like that. So how much of that research, first of all, how much you were involved in monitoring COVID for the sake of your career, and how much of it was for the sake of real public health here in Denmark?
I think a bit of both. It was for public. I was at Imperial College London, which was
Mm-hmm.
very very prominent early on in the pandemic,
Mm-hmm.
and so with my colleagues, I was right there at the start, right?
Yeah.
And was involved in advising the UK government by an organization called SPIAM. And it's a really wonderful use case because it was a team of modelers, many teams of modelers congregating every week to discuss models. And, there's lots of disagreements in that because everyone thinks their model is the best. And so it's a really nice model of, discussing in scientific dialogue.
It was a UK level thing.
UK level. And it's so nice to sort of meet with colleagues and discuss the science based on the science alone, right?
Yes.
I think there's always a perception that these things happen is sort of behind the scenes by some conspiracy, whereas in truth it's just scientists trying to do the best they can, and everyone doing the best they can. And we can all disagree on opinions, but no one really gets into science to do. There's better ways to fulfill your conspiratorial desires than
Sure.
do things in science. So often, depending on how you sit on the coronavirus side, there's lots of acrimony, whereas with scientists doing their best and saying what they think by their papers. And then, of course, when I moved to Denmark, was partially involved in the Danish epidemic. I was special advisor.
Was it a professional choice to move in here, or?
Yeah, I mean, I'll get to that. It essentially, I guess there was a position opening in Denmark, and my wife is Danish, and I thought, maybe we should apply, and then one thing leads to another, and then before you know it, you moved country, right?
Yeah. Because I mean, as far as I know, working as an epidemiologist or anything related to that in the UK is one of the best places you can be, right? Like so many huge number of people working on that. I remember when COVID started, the number of experts that were in the UK were not even comparable to the number of experts in Europe, right?
I mean, part of the big thing that brought me to Denmark was funding from the Novo Nordisk Foundation, looking at AI on human health.
Yeah.
And in that regard, Denmark is truly exceptional because Denmark has the registers.
Yes.
And many people think, well, if you were in China or India today and you said, well, we'll just track every individual from today, it would take you 30 or 40 years to catch up to where Denmark is, because Denmark has a full birth cohort starting from the 80s, tracking people over time. So what you really have is this longitudinal record over time. And I think it's one of the aspects that are generally missed from epidemiology. Right? We always think of you have a 80% chance of cardiovascular disease, right? What does that mean? That means, if you lived 100 lives, 80 of those will result in cardiovascular death at a certain point. Whereas in truth, you are one individual, you are unique, and you've had a series of events happen in your life up to this point.
Yes.
In a sense, it's ergodic. That you want to see how things change over time. And I think the Danish data provides a unique way to study this. And lots of people in Denmark are looking at these trajectories over time. And I think it's a really exciting area of research.
Yeah, let's talk about it. So like in Denmark, there are so many interesting data sets. One is the data which comes from registry, which means we know where people live, they have lived so far, and apparently a huge amount of details have been recorded in a private way, and only researchers can use, so no corporates basically. And then it is somehow unique because no other country has access.
Few Scandinavian countries have, right. A few countries are comparable.
And this was like kind of interesting for you in a way that.
Yeah, it provides you a unique opportunity to to study human health
Okay.
because the data is there, right?
Mm-hmm.
And there's a rich history of this in Denmark, right?
Yeah.
Coming to University of Copenhagen, suddenly you are meeting all the people who have developed most of the major breakthroughs in survival analysis.
Yes.
And it makes sense that they are here at University of Copenhagen and in Denmark because this is where the data allowed them to really,
Okay.
the need was there. So yeah, the data is incredible. It could be much better, right? Integration of primary care, general practice data, integration of pharmaceutical data. All of these, I think, should be put more into the data systems, and then we can end up with another avenue for AI in a high income country where we can really evaluate population level health in a more powerful way, right? COVID-19 comes, right? We know COVID-19 has higher risk for diabetes, people who are diabetic, people with metabolic conditions.
Yes.
If we know the general prevalence of certain conditions within the population and the risk factors, we can determine population level risk far more accurately than you would do in another country where all you have is age.
Yeah.
That's the only thing you could do to calculate the infection fatality rate. You stratify by age. That's it. And so you end up being far more prepared if you know more on the population.
Yeah. And how do you think your contributions to Danish society has been so far in terms of using these data and giving new insight or new prediction tools, maybe?
I mean, I guess I'm always negative with my contributions. So I'd say I've contributed nothing.
You're just so humble?
No, I don't know. Maybe I just keep trying to do
No,
something
my whole
big.
point was that, like, did you get what you were really interested to do with the data?
I think we're getting there, right? Some people on the team are doing some incredible work, right? And obviously, it's a team sport science, so
Yeah.
it's definitely everything that I do is based on large numbers of other people working behind the scenes and on the scenes, whose work is incredible. Yeah, we're getting far more to it, right? For example, we're looking at questions of persistent infections, looking at questions of long COVID. I think, as we move forward, if we can keep expanding the collaborations that we have, maybe we could get more preparation for the next threat, which could be something like influenza. And so I think we are getting to where we want to be, but I think we still have a long way to go.
Yeah. How big is your team now?
Honestly, I lose track sometimes because I guess I don't count very often. But,
Yeah.
I co-lead the group with someone else, and together I think we probably have around 25 people.
And what blend of people do you have? Are they mostly coming from STEM, or are there do you have mainstream epidemiologists in your team and then mathematician and then computer science?
I mean, I'm very proud of this. I think we have a complete
Okay.
split. I guess we just try to take in people that are like us, so excitable individuals that enjoy the science. And so, we have some physicists and some biologists, some epidemiologists, some medically trained individuals, a bunch of mathematicians, a bunch of computer scientists. So we really have, I guess we're missing a chemist, but we really have a very, very big spectrum of interdisciplinary research across the group.
And now, are you also keeping your collaboration with your colleagues back in the UK?
Yeah,
or in the British government, or?
Yeah, I mean, I'm not all. I mean, the organization that I was belonging to has closed down after COVID, of course. But I still have a 20% position at Imperial College London and work a lot at Imperial. It's an institute that I really love. So I still have some members of the team over there, and they're doing incredible work as well. And I think, it's an opportunity for the future to sort of try to learn from two different countries. Right? There's incredible data in the UK that Denmark does not have access to.
Yeah, but at the same time, these two countries are very different. Population-wise, cultural-wise, everything-wise,
Everything, yeah, they're very, very different. But I mean, I guess we can learn lots of strengths from that regardless, right? Those differences end up being interesting.
Okay. Let's talk about some of the challenges you do have now then. So you are working on epidemiology in I don't know, maybe the better word is public health because it gives a more complete picture of what you do. But at the same time, it's a very complicated problem. and you have to deal with so many things that you cannot really do a counter analysis for them. For example, in terms of let's think about the COVID time, and with COVID, we did a lot of interventions. And when we want to evaluate one of the interventions, it's very hard to say because, like, what if we didn't do it? Like, we don't know in a way because there is no other universe to try that. And when it comes to any other disease or any other thing related to public health, it's always very hard to do this type of thing. So in your everyday type of thinking that when you're doing a research and then you think, okay, there are these dark corners that I cannot really get into. Uh, how do you feel about it? Like, what are those dark corners for you at the moment? Like,
Yeah, I mean, in infectious diseases, I've kind of made my peace with this, right?
mhm,
Because part of the problem stems from human decision making, unfortunately.
yeah,
This need to have a definitive binary, yes, no.
mm,
And the truth is in epidemiology that uncertainty is so big,
yes,
these systems are so dynamical, and the goalposts are changing day to day.
mm,
When you look at like coronavirus 1 week to the other, or influenza 1 week to the other, things change culturally, medically, pharmaceutically, behaviorally throughout, right? And so I guess what I'm trying to grapple with is how to communicate the uncertainty in this
mhm,
to policymakers. Because ultimately my job is to do the science and communicate the answer to public policymakers. And ultimately this when you do the science correctly, you end up with we estimate this, but there are all these caveats.
mm,
And the policymakers don't want those caveats, they just want a
yeah,
decisive answer to their question because
mhm,
that's their job is to make a decision, a binary decision.
yeah,
And they want us to provide a binary answer to them.
mhm,
So this is the dark corner in terms of how do you really determine uncertainty, and it's why I'm so interested in Bayesian statistics, because
mhm,
it does provide the formal framework
yeah,
to sort of give the uncertainty and encode your beliefs in a
mhm,
system. I guess the other dark corner that I'm to some degree worried about is I think that AI is getting more and more powerful, but access to it is or ability to run AI is incredibly limited, right?
mhm,
Our group is constantly applying for funding for GPUs, and the amount of GPUs, the number of GPUs you need to GPUs, of course, the graphical processing units that run lots of the top AI models. The number of GPUs you need just seems to be so high, and the barrier for entry is so
mhm,
high. So you could be the most brilliant researcher with the most brilliant ideas,
mhm,
and you don't have a chance to get in the AI game because these models are so large.
yeah,
Yeah, and I mean, yes, there's good innovations coming out, for example, with DeepSeek about making these models more efficient and
mhm,
smaller. But ultimately, you know, look at the landscape of large language models out there now, right? There are only a few big players in the game, and those
and most are commercials.
there are commercials and one governmental player, right? And the commercials are having data centers
Yeah,
that aim to be the size of Manhattan. Right?
yeah,
I mean, I'm not just we can't even get 10 GPUs in
mhm,
access in our group to do the research we need to do.
yes,
The barrier for entry is enormous, and this creates an inequality and a control. And from a public health viewpoint, going back to my original concern of
mm,
empowering low and middle income countries, I do have concerns here about this and how this factors in.
yeah. Like every time I think about it, especially thinking at the Europe level and comparing the amount of GPUs or whatever computational processing unit they have in the US, most of them dominant by some big companies and or the government, and then compared to the whole Europe, it's kind of thing that I mean forgetting about like low income countries, even when you look at Europe, it's not comparable.
No.
And it's kind of to me, it's just like that we look at AI and how good it is, but at some point we realize that everything that they're doing is just like in the pockets of some big brothers or like I don't know.
Yeah, I
And
mean
it's
it's sort of it's an access kind of thing, right?
yeah,
It's already hard enough in low income countries to just have compute to store some data, right?
yeah,
A few terabytes here and there. It's already difficult in the field to have the internet bandwidth to
hmm,
load these up. Now it gets more challenging. But I mean, yeah.
Do you think there should be some like sort of international agreement or some?
This I wish I knew. I mean, I don't have the expertise, unfortunately, to say this. I mean, I kind of have some ideas, but I'm pretty sure they're poorly informed and
Yeah.
biased on things. I'd love for there to be a good consensus on how this proceeds, but this moves away from science
Yeah.
into the politics.
Okay.
And I guess, just off the top of my head, which leads me, of course, to the other big dark corner that I kind of think about all the time now, which is it's been a discussion that's happened in public health for decades, right? Which is how you look at the individual and how you look at society as a whole, right? So, for an individual, we could start giving them all the treatments possible to help them be as healthy as possible, to some degree, as is wrong, turn healthy people into sick patients by just treating them early and focusing so much on the individual. And there's a lot of ideas for this so-called precision medicine that is targeted to the individual, right? We have our watch, we have our sensors, we have everything on us, right? But coming with that is an extremely large cost for individual, right?
Yes.
Whereas at a societal level, education, looking at income and health inequality, looking at general, diet and nutrition, exercise. And the fact is that we all know, right? All of us know what it is to be healthy because it's stayed more or less the same since the 1920s in its first large principal components. New science comes about all the time, but the sort of way of nutrition that our grandparents would focus on and what was healthy then remains largely true now.
Yeah, instead of smoking kills.
Instead of a plant, yes, instead in a plant, yes, exactly, in a plant-based diet and all these other factors. So how public health grapples with this is challenging, right? And where the complexity lies is challenging, right? I guess in physics, there is something called the blessings of dimensionality, which is, you have so many particles and yet together you have simple laws that determine them in the sense that lots of data exists on a lower dimensional manifold. How does this look like at different stratifications in public health? This complexity angle is very interesting.
That is actually one of my very, very favorite type of questions, like this whole saying that when you look at two different levels of descriptions and you have this huge dimension, but that it requires its own podcast.
Yes,
and we should talk one day.
Probably someone who knows more than me.
But it's a very cool thing to say. And so how do you think like so we all know now that US is not going through its best days.
No.
And sadly it's basically influencing the whole world and the whole global health in a way because a lot of fundings are cut, especially regarding these type of things. I don't know. We have never been this close to having good vaccines for new disease, especially thanks to these mRNA technologies. So how do you feel this? How do you think it's changing the way that we were going for improving the public health?
I mean, it hurts to the stomach, so to speak, because the US has been a leader for decades. The PEPFAR initiative for HIV in sub-Saharan Africa. One of the initiatives I worked with called DREAMS, which was preventing HIV infection in young women. Instrumental, right? Playing an enormous role in helping the most disadvantaged people in the world, right? And I guess this leadership was important because it also other countries followed with it. And sadly now, although the winds have been changing for decades now, as well, or at least 5 to 10 years, there's just less and less appetite for investing in, or looking after communities that are the most disadvantaged. And it's a shame, and I don't know what's going to come on this because it's ultimately there are good ways and bad ways to step away from investing in other countries. And I think science has shown many times that you get back the returns from investing in other countries in this regard, right?
And how do you think Europe has been behaving after COVID? Because like I know that since COVID, a lot of researchers got into epidemiology or public health because there was like tons of money available. and now almost all the monies are gone, and a lot of people are either going to some other disciplines or like,
Yeah,
and it's getting more competitive to stay in these type of areas of research. And I don't think like Europe is also now is had a lot of financial issues, so they cannot like basically.
that's right. It's I mean it's a mistake because again it's going from one extreme to another, right?
Mm,
The risk of another pandemic is still as high as it was, right? And the consequences of another infectious disease are incredibly high,
yes.
and the costs to society incredibly high. To walk away from investment
Mm,
is just is a short-sighted mistake, right?
yeah.
I'm not saying it should be the number one priority, quite the opposite. There are lots of other political priorities, but it should be something considered more and more. And I think Europe still does have, at least from my look of it, a reasonable focus on this. It doesn't feel to have walked away in quite the way that the United States has, and with quite the kind of blunt instruments in terms of how it's walked away, right? So I do have some optimism that Europe,
Yeah.
could be the place where new innovations in this field can continue to spurn, and that's my hope, really,
Okay.
because I think on a personal and emotional level,
Yes.
these are children dying in sub-Saharan Africa of preventable illnesses,
Yeah.
right? And as much as we want to say they're different, and to lose a child, I'm
Yes.
sure for anyone listening, for example, to lose a child, I mean, there is no world where that isn't a truly traumatic and horrible experience from a preventable illness, right?
Yeah.
And as a society, if we can't do what we can to help the most vulnerable, what does that say about us?
Well, yeah, I mean, this is the question every day I'm asking myself, especially about the things happening, for example, in Gaza or other places, that maybe in my grandfather's time, people couldn't see it, but now I'm seeing it in 4K, that kids are dying. And I would say, no matter where you're from, what you believe in, that is sad. And nothing could be sadder than seeing it.
That's right.
Yeah.
And so yeah, looking after the most vulnerable in society is a goal. And I guess we're more focused on the infectious disease aspect.
Yes.
And I think when smallpox was eradicated and polio was close to being eradicated, there was an overwhelming amount of optimism on the
Yes.
trajectory that we were going on.
Yeah.
Our colleagues at the Institute for Health Metrics and Evaluation, have been charting the global burden of disease for several decades now, and the trends have been very positive. And you can just see the change from infectious disease being the big killers in low-income countries to transitioning to the things that kill people in high-income countries, cardiovascular disease, cholesterol, etc. And the concern is, are we going to slowly drift back?
Yeah.
And I guess that's where I think the field in general needs to provide solutions to somehow stop that. Yeah.
Yeah. Okay. Let's get back to this investment of like Denmark in AI. So apparently Denmark is now a big fan of AI in all disciplines. Like recently there was this new center for, what was it called? Center AI for Society or something. So apparently it seems that for good or bad or whatever, Denmark is pushing for this. And do you feel that it's gonna help us a lot here as like researchers working on these type of things, that AI would be a big thing, so that as long as we are using AI in our public health research, we can be more benefited than before? Or is it like, no, this AI thing happening is more on the other subjects or something?
I mean, there needs to be investment for several reasons, right?
Yeah.
Number one, you start with the binary decision that AI is going to be very important in a number of fields. If it is, you need the compute to do it. Number
Yes.
one. Number two, for those working in technical areas in programming, they might be used to using programming languages like JAX, PyTorch, TensorFlow, these general scientific computing libraries that now make it seamless to run on GPUs or CPUs, right? And I remember in the past to do GPU computation on CUDA, it was a nightmare, right? I mean,
Yes.
you didn't even think about doing it because the documentation was so hard, right? And now, Jack,
piece of cake.
yeah, one line run on 4 of my GPUs or run on my CPU.
Yes.
So just general computation
Mm.
is incredibly important
Mm.
on using GPUs in compute, right?
Okay.
And yeah, there's a large cost to these, but if we want to be engaging in these fields, we have
Yeah.
to have the investment in computer. And I do see lots of European countries in this. I see Denmark especially, with the Gefion initiative, right?
Mm.
That's what's required, right?
Yes.
And it's fantastic to have, to be in a country where such kind of investments are made.
Mm.
And I'm excited to see what kind of projects will come
Cool.
through in Gefion.
But if you want to talk about some hypes about AI,
Yeah, it is a hype field. I mean,
so what are the things that annoys you? Because I mean, there are people. I mean, I don't want to stay with those that are always like AI is bad, and there are others AI is doing everything for. I mean, I always prefer to stay somewhere which is more closer to reality. Like, what is the hype that annoys you the most about using AI or something?
yeah, I guess it's what it can deliver, right?
Mm-hmm.
I think the promise of AI is, I think deep learn. Let's leave AI behind and just talk about deep learning. The
Mm-hmm.
power of deep learning has been in creating new interesting architectures, almost like engineering, right? When you look into AlphaFold or you look into AlphaGo, some of the things DeepMind's doing, or you look into, Transformer, it's about these architectures that are doing amazing things, right?
Mm-hmm.
And these architectures are being designed to work on specific types of data
Mm-hmm.
and solve specific kinds of problems. And I guess what really frustrates me is somebody coming with tabular data
Mm-hmm.
for which, in all likelihood, a linear regression
Yeah.
will give you almost all that you need for it.
Mm-hmm.
And if not linear regression, very little will be better than XGBoost or boosting or random forest. And then they will say, well, we will use AI.
Yeah.
How? What are you going to do, right? Well, how
Mm-hmm.
will AI benefit this problem in the slightest, right? Yes, AI could do amazing things with videography, with images, with text, with audio. But in this tabular data
Mm.
realm where we just have a matrix
Yeah.
and we're trying to solve a simple regression problem,
Mm-hmm.
this is hype. And this is sort of, is providing virtually no value. And, paper after paper, they implement an AI method, have a tiny benefit, and the linear regression is basically, for all intents and purposes,
Mm-hmm.
practically as good and
Mm-hmm.
far more transparent,
Mm-hmm.
far more reliable and fast with less computation.
Okay.
So that's one of the hypes. The other hype is that yeah, the AI will solve an entire field, right? These AI hallucinate quite a bit, and we need more progress on them. And I guess people, like, coming back to my central thing about computation, people take for granted how difficult it is just to run these AI models. You can say, I will do this for this project, and I will implement the best AI approach and run it on the server.
Mm-hmm.
How are you going to do that without spending your entire grant budget on
Mm-hmm.
GPUs?
Mm-hmm.
The barrier for entry for just running these, forget developing them, just running these models is incredibly high.
Mm-hmm.
And I think that a lot of people take that for granted
Yeah.
in terms of the hype, that it has to be realistic in terms of what you can accomplish on these models,
Mm-hmm.
given a certain amount of funding.
Yeah. I saw among your books here that you also have this network science from Laszlo Barabási.
Yes, yeah, great book that.
Yeah.
Yeah.
And I mean, I'm a network scientist to some extent. So I know there are a lot of people in that field working on this network epidemiology. Have you ever been involved with any of those projects, or how do you see it? Like, because like before AI, it was like one of those very avant-garde in a way
Yeah,
approaches and coming with like, because still it was rooted, it was grounded in mathematics, equations, and data, still no black box type of thing. And then it was giving more interesting result, like the way that you can look at the heterogeneities in the populations in terms of number of connections. And
it's still one of the most central topics in infectious disease modeling, right? Because ultimately infections do spread over a network, right?
yeah.
Where the problem lies, and I guess why network science isn't the number one tool in infectious diseases,
Mm-hmm.
is the data still isn't there, right?
Mm.
I mean, we've even in coronavirus, where we got amazing mobility data from Google, to really understand contact patterns between people, right? This is data that the large AI companies, of course, have because they sort of use this
They
information
gather
on
it.
Google
Yeah,
Maps.
yeah.
I mean, it's how Google Maps is so reliable in knowing where traffic is, right?
Mm.
You know the mobility patterns, mobility flows, mobility fluxes. The problem is that we don't have this data to process for use in infectious diseases. And so what we're doing is sort of skirting around the data, trying to use genetic data, trying to use temporal data, trying to use contact tracing data, trying to use everything we can
Yeah.
to answer the most fundamental questions, which is, which is I guess your topic of interest. What do human contact patterns look like?
Yeah.
What is the variation? What is the nature? What's the structure? And how do we
Mm.
characterize this? And then how do we build a mathematical model that accurately describes this? Is still one of the most interesting topics to answer, and I would love to work more on it. I guess we just need to be given the opportunity to really touch the data that would allow us to access
I
it.
guess in your team, you are working on building this transmission network based on the genetic data.
That's right. Yeah.
Yeah.
That's right. That's exactly right. So we're trying to do it with genetic data
Uh-huh.
because, of course, if I infect you with coronavirus, these viruses they measurably evolve. That's what's called measurable. They have that. You can actually see the process of evolution over time because the viruses have such a high mutation rate. And so, if I infect you, we probably have an identical sequence. However, then if I look at you and an individual that was infected 3 months from now, a lot more changes would have occurred. So the genetic data allows us to sort of get some degree of similarity. So does time, right? If you have an infection 3 months from now, it's zero chance that I am the one who infected you.
Yeah.
Because it couldn't have happened. Once again, if you live in Singapore and we've never met, there's zero chance I could have infected you, right? GM theory still requires us to be
locally
proximate.
Yes.
So yeah, you can use these kind of models to get some determination. But in truth, if we could really get access to the data about who's meeting whom and deal with the anonymization and privacy invasion that comes with that, it would be transformative for the field of infectious disease to really understand how contact patterns happen. I mean, there's been some great studies, one called the Polymorph study, which looked at contact patterns in the last ages. But to really determine the heterogeneities in terms of who's meeting whom when and how this changes over time, this would be fundamental information for infectious disease. This would transform the field, I think, and would transform the field in a lot of regards in terms of how and it would really help us in terms of formulating interventions that aren't just a blunt tool, but far more targeted.
And in terms of like network epidemiology, do you believe, or let's say it this way, what insight do you think was the best insight that came from looking at populations, not like that we are in a big cocktail, like with fully mixed population type of approach?
I mean,
do you think there was like a huge insight or something that network epidemiology made people at least think more about it more carefully?
I mean, definitely, right? I mean, and I think, the fact that over-dispersion is so prominent in infectious disease modeling is a result of network science, showing that this is not a homogeneously mixed population, and that, great amount of uncertainty exists because of different connections.
Yes.
At the same time, one reassuring factor is these models that are built on homogeneously mixed populations, they don't work too bad, surprisingly. So, it's I think in network science, there is if you had to ask me the same question about what annoys me most about network science, it would be the overwhelming focus on scale free, right? Everything scale free, everything scale. It's, it's overstated to a large degree, the nature at which infection processes are scale free. And the truth is somewhere in between. It's not just a Poisson, and it's not entirely long tail, but it's somewhere in between. And I think that the discussion around this is, sometimes unhelpful.
Okay, let's circle back to daily research with you. So now you're having PhD students as well, right?
Yes, yes, lots. Yeah.
And when someone comes to you and say, "Hey, Sam, I like what you do as a researcher. I want to join your team." So usually, what are your criteria for having someone? Because like what you do is not a mainstream type of field of study. So people who should come to you should have different types of skills, different backgrounds. So how do you basically deal with people joining your group? What do you expect them to know, or what type of like, I don't know, what is your criteria? Is it like the skill sets of people, they taste, they open-mindedness or something?
Open-mindedness is the number
Okay.
one, right? I'm a big believer in it's very hard in these fields to get somebody in who can do the job straight away.
Mm,
And at the same time, in academia, we don't have recruitment rounds like they do in industry for, 12 recruitment rounds on
yeah.
site. So I'm a big believer in cultivating talent
Mm-hmm.
rather than hiring talent. So I
Mm-hmm.
think, my number one sense that I'm trying to get when somebody's in, are they interested and excited about this?
Mm,
Are they excited about a challenge?
mm-hmm.
Right? Can we solve this challenge together? Right? Are they
Mm-hmm.
interested in the work? And honestly, if they can do that, I think, they can learn
Mm-hmm.
all the bits they need. It's the number one aspect,
Okay.
right? Yeah.
And then how is the interaction between you and your team, like your PhDs and postdoc? Is it like that you prefer to talk to them like on a weekly basis or monthly basis, go through what they're doing, talking to them, giving them insight, asking them to, hey, go and read this, go and read that, or you're giving them, I mean, I don't know how it is, but some people are like, okay, you need to know this, go and read this and come back to me.
No, I'm a bit more like we discuss things as colleagues.
Mm,
So I'm always available to discuss aspects,
mm,
but I won't necessarily insist at all. In fact, I quite like the opposite, insist on having weekly meetings and updates every
mm,
week, right? I'd rather
mm,
we don't meet for 2 weeks, and
mm-hmm.
then if we have to meet 4 days in a row,
Yeah.
fine,
Mm-hmm.
that's good. If we have to meet for the whole day to talk about a problem, fine. It's
Mm-hmm.
as go we work as collaborators on a project together.
Mm-hmm.
I found that management style works well for me, but I mean, I think everyone has their own needs for
Yeah.
this degree, right? And I
Mm-hmm.
think this is and when you say hiring PhD students and for junior researchers out there,
Yeah.
it's important as a junior researcher to pick a supervisor that matches how you like to work.
Mm.
Some people really love structure and some people don't. And you
Yeah.
need to pick a supervisor that matches that or you
Yeah.
or you end up with lots of conflict. So that's the way I like to work. I still like to do lots of maths and programming in my own time.
Oh, you do.
So yeah,
Okay.
it's the only if I had to stop doing that, I think that would be it for me for academia. So if
Yeah.
I only had to do management,
Yes.
of course, I'm not as good as my staff anymore, but it's not really about.
Mm.
I don't think I'm going to achieve something better
Yeah.
than my
Yeah.
staff, but I enjoy doing it.
Yeah.
So
Because we were talking with Suna and I asked him that, do you still code? And he said, well, most of the times, not heavily, because like I have people who do it in my team. But when I, especially when I want to teach or something, I am always very happy to do it.
no, I still write my own code all the time. Try to learn new things. Try to do new maths, explore new ideas.
Mm-hmm.
And then if the idea ends up being interesting, I can then pass it on and have someone flesh it out or just do it myself. But I still have hopes to do work myself, right? I don't want to, the worst thing would be to feel useless that I can't, if all of my group disappeared, I couldn't
Mm-hmm.
do anything.
And what is your recommendation for people who join you as postdocs or something? Do you recommend them to stay in the field of public health and this type of thing, or do you think that if how do you feel the field is going in terms of so of course we have public health institutes and we have academia. And with academia is always more complicated, especially now that a lot of fundings are
Yeah,
gone
that's what I
and
was gonna say. Yeah,
yeah.
yeah. I mean, I think as postdocs, you have to do the best for your career, but you have to accept that your entire career can hinge on a paper,
Mm,
which itself is three reviewers.
mm,
3 scores does not make a reliable statistical average, right? So the
mm,
the, the variation is huge.
mm-hmm,
And so I think, for postdocs now, I mean, I feel terrible for many people doing their postdoc now because it's really not a good time to be doing a postdoc, right? Funding is low and
Yeah.
the positions are not opening.
Mhm.
And I think things might change in the US, one of the biggest employment areas for assistant professors.
Yeah.
Will reduce as time goes by. So the options are just getting less and less.
Mhm.
And I think industry might be a good option for lots of individuals, right? There are lots of positions in industry that are virtually the same as academia with better structure.
Mhm.
And sometimes working in academia with the open-ended contracts without too much team support, I've seen lots of people who dislike that. And sometimes all they really want to do is research, but within a team. And industry
Yes.
allows that to happen.
Mhm.
So I think for a lot of postdocs now, I think I would recommend not to shy away too much from industry, because there's some great jobs there. And in academia, to not let all of us get hit hard by rejections. We get rejections all the time. I get rejections constantly,
Mhm.
and I'm upset by them all the time.
Mhm.
To not let it to hit you too hard and take it too personally. These things just happen. It's part of
This game.
this game, and it's the worst part of academia, and we have to accept it that you have to spend 2 months writing a grant, and the answer is probably no. And those 2 months
Yeah.
are sunken cost. That's what we have to do, and don't take it too personally and hinge on it too long. Just try to move on and not let it get you down too much. Easier said than done, but yeah.
If you go back and you like in your 20s or something, would you still be studying the same courses, getting the same research topics, or would you try something else? Do you think there were some other interesting topics that you kind of missed and you accept that you missed it because you didn't have enough time?
Yeah, probably. I mean,
Mm,
I'm a big fan of history, so I would love to have been a historian as well, and big fan of literature, and I still love particle physics, reading about it in popular science, so I would not mind doing it. If I had to go back, I certainly wouldn't do chemical engineering, and I probably would have chosen mathematics or computer science
Okay.
or physics. One of those, probably mathematics would have been my
Okay.
go-to, and that's what I would have done differently. But yeah, I don't think I would have. Yeah, I guess yeah, probably that's what I would have perhaps changed back in time. Yeah.
And something uh, maybe interested for people who are much younger. So you are, I mean, by any measure, you're a very successful scientist. Your career is now very interesting for many people. Many people, including me, wish I were you.
No, it's very
You
kind of
have
you
a
to say.
huge number of citations, very important papers, like, uh, and apparently you are very career oriented. But when people look at you, what are your other hobbies? What do you do next to doing research?
Me,
Yeah.
I used to really enjoy music,
Mm-hmm.
so I played the saxophone, but I do less of that these days.
Yeah.
And I love reading. I absolutely love reading nonfiction, fiction. I think that's my primary hobby, to just
Mm-hmm.
read books and listen to books more. I do these days, and I think that's my number one hobby. And what's associated with that is listening to books while doing exercise now is my hobby. But I suppose once you end up with children,
Yes.
your hobbies dry up a little bit.
Mm-hmm.
So right now, I think I don't have a huge number of hobbies, but I do think sometimes that the work is a hobby to some degree. Some days when I'm just sitting at home reading or learning about some new area of mathematics that I find difficult,
Mm-hmm.
I am realizing that I'm doing this out of fun rather than anything that's actually beneficial to my
Okay.
career, right? Like I'm actually wasting time, right? I should be doing other things. I should be doing something else for somebody in the group. And
Yes.
instead I'm here, reading about some kind of algebra. And so I do think that the work is to some degree still a hobby.
Okay.
And I think I'm lucky that at least I see it that way.
Cool. I guess it's time to stop. We already have been here for quite a long time. But if you want to say something about like, how would things be in Denmark better for you or better for research or for the better sake of public health, or do you have any concern or anything regardless of this conversation? if you want to say something about uh, grants or the way that the government and the interaction between scientists is, or anything that you wanted to be changed or something, what would it be, or anything?
Surprisingly, no, not really.
Mm,
I'm very happy in Denmark. I feel very accepted in the university. My colleagues are very nice.
mm-hmm,
Everyone can always say, wish there were more funding opportunities.
yeah,
But I mean, I can see how the landscape of the world is changing, and I can empathize with the people above me and how difficult their jobs are to deal with these aspects
yeah.
in Denmark and in the UK.
Mm,
So really, I think no, I'm in a very privileged position.
mm-hmm,
I am not like the postdocs coming up now. I did my postdoc in a time of far more opportunity,
mm-hmm.
and I think it would be bad of me to start complaining, given how privileged a situation and how privileged a run I've had. So all I can say is to be grateful for the opportunity here, be
Mm-hmm.
grateful for my opportunity in Imperial College London, and try to help the junior staff
Yeah.
as much as I can. And that's what I'd like to sort of do.
Yeah, very good to hear that. And where do you think your research will be in 5 or 10 years from now?
Oh, hard to know. Hard to know. I maybe more back into the genetics aspect, and maybe deeper and deeper into AI. It's hard to know. Again, I love the fact that I have my tenure position, and that at any point I can just do something interesting that I want to do, and I don't have to worry about losing my job. And I think that we should exploit this privilege in terms of doing good science, rather than just staying in the field that we were once in, right? It's good to be interdisciplinary. It's good to learn about new things. And I think most people in science, they're in science because they love that aspect.
Yeah.
And when you get tenure,
Yeah, that's the time.
perhaps that's the time where you can follow some passions a little bit more.
But is this genetic side more of your passion, or do you also see that there is a huge avenue which may be
No,
open?
it's a passion. I mean,
Okay.
evolution has always been
Yes.
ever since I first picked up The Selfish Gene
Yes.
by Dawkins,
Yeah.
and read that book, and at the end of
You're
it,
amazed by it.
at the end of that book, thought
Wow.
this is the most fantastic book ever
Indeed.
written. And then of course in my PhD studying viral evolution, it has always been, evolution by natural selection,
Yeah.
the mechanisms by which evolution happens, and it's getting more and more complicated in a time of genetics, and I think we're at a point where new theories need to be developed to explain some of the more complicated patterns that we're seeing. I think it's an exciting area, and it's always been exciting, and I'd love to do more, and I'd like to sort of move outside of just looking at viruses and looking at other pathogens or looking at other organisms.
My last question would be, what has been your happiest and saddest day in your career?
In my career, that is difficult. I guess the happiest day probably was when my paper, my most cited paper was a paper on dengue. And we submitted it to Nature, and it came back with a rejection. And then we appealed it. It went to another reviewer, and then it was accepted. And I think that was the happiest day.
This is your PhD paper?
No, my postdoc, my second postdoc paper.
Okay.
That was the happiest day of the academic career, because I think everyone knows what that means for your career, right?
Yes.
And I knew it was a good paper, right? I knew it was really good paper. And I think the citations show that to some degree. And I remember thinking at the time, few days in life can be this sweet. And I thought, that's fantastic.
Yeah.
And then the worst day, I mean, I don't know if there's any single worst day, to be honest. I think every time, I guess I'm that kind of personality, and I'm happy to admit it so that others can hear that this is what people are like. Every time a paper or a grant gets rejected, that's the worst day. That's the worst day. My wife knows that I'm coming home and something has been rejected, because I'm a bit upset that day.
Yeah.
So I think that though there is no single worst day, they
Yes.
all amalgamate into, and that moment being the worst day, and
Yes.
then you build and go for it. I can't say that I have a single worst day, and again that comes back to what I was saying before, that if I can't say there's a single worst day, I'm pretty privileged in that.
Okay, cool. Thank you. It was a very great conversation, I would say. I really enjoyed it, and I hope people who watch it later would
Yes,
enjoy it
thanks.
as well.
Happy for anyone to reach out and
Yes.
discuss if they want.
Thank you, and have a very nice day.
Thank you.
Yeah. Bye bye.